HRCT chest. Clinical info. Productive cough, exertional dyspnea for 1.5 years. Wheeze, intestinal TB 20 years back. Technique. 0.6 mm reconstructed images from a scan performed on multi-slice CT scanner, with low radiation and high definition mode, reviewed on workstation using different window and level settings. Non-contrast HRCT chest is performed according to departmental protocol. Findings. Lungs. Lungs are hyperinflated and show mild to moderate centrilobular emphysema having apical predominance. Few calcified matted right hilar lymph nodes are seen with associated mild fibrotic changes causing narrowing of distal part of right main bronchus as well as proximal lobar bronchi. There is focal cystic bronchiectasis in perihilar segments of right middle and lower lobes with parabronchial cuffing and multiple small air fluid levels in these dilated bronchi, consistent with acute bronchitis. Adjacent multifocal small subsegmental patchy consolidations and mild ground glass attenuation is also seen. Mild interlobular septal thickening and few tiny parabronchovascular ground glass nodules are also seen at places. There is minimal atelectasis and few tiny nodules in lingula and posterior segment of right upper lobe as well. There is no pleural effusion or pneumothorax. No honeycombing is seen. Mediastinum. Thyroid is normal. Multiple small subcentimeter partially calcified mediastinal and bilateral hilar lymph nodes are seen. There are few mildly enlarged partially calcified subcarinal lymph nodes measuring 10 to 11 mm in short dimension. No axillary or supraclavicular lymphadenopathy is seen. Heart. Great mediastinal vessels and esophagus do not show any abnormality within limitation of non-contrast examination. Gastroesophageal junction is collapsed. Trachea and major airways are clear. Chest soft tissues are symmetric. Upper abdomen. In visualized upper abdomen, mild nonspecific congestion and fat stranding is seen in visualized omentum and mesentery. A couple of right renal simple cysts are seen. Largest one at upper pole measures 11 mm. Rest of the visualized upper abdominal viscera and bowel loops do not show any abnormality within confines of non-contrast examination. Osseous structures. Age-related degenerative changes are seen in visualized osseous structures. There is no aggressive osseous lesion. Impression. Hyperinflated lungs with mild to moderate centrilobular emphysema having apical predominance. Above-mentioned findings are consistent with acute on chronic bronchitis with heterogeneous airspace consolidation of surrounding lung parenchyma, consistent with active inflammatory disease process. Findings are not typical for COVID pneumonia, however, cannot be entirely excluded and require clinical and lab correlation. CORADS 3.